Metro Optics is pleased to present this unique training tool to help you fit your presbyopic patients with a MetroSeg Crescent Bifocal. The MetroSeg Crescent Bifocal exhibits the most desirable characteristics that can be found in a segmented bifocal contact lens. The advantage to the unique Crescent design segment is that it can rotate up to 30 degrees without interfering with distance vision. The area between the near and distant segment has a unique junction that causes the lens to self-align during the blink. This keeps the near segments and the distant segments right where they need to be. Because of this unique junction feature, the prism ballast that's usually incorporated into a segmented lens to control rotation can be minimized. This allows the lens to be thinner and more comfortable for the patient. A feature that's caused some patients discomfort with other segmented bifocals is truncation. With the MetroSeg Crescent Bifocal, this has also been eliminated in most cases. It is recommended that the bifocal be designed first without truncation, even for those patients who may have truncation in their current lenses. The MetroSeg bifocal lens utilizes monocentric optics, which eliminates the image jump that can occur with bifocal lenses. This allows a more comfortable transition between near and far objects for the patient. With this design, there's an unlimited amount of add power available for a patient, making the MetroSeg a suitable lens design for emerging as well as mature presbyopes. Front and back toric curves can also be incorporated into the design, allowing those patients with moderate to high degrees of refractive and corneal cylinder to also take advantage of the benefits of bifocal contact lenses. To begin the fitting process, it's recommended that the contact lens professional conduct a thorough pre-fitting exam and interview to determine the appropriateness of this lens design for the patient. Lenses that employ the alternating or translating vision principle are excellent choices for patients who require crisp vision at distance and/or near. This would include people who spend a great deal of time viewing near objects at a desk or viewing objects at a distance. Patients with at least one diopter of add power who've experienced compromise with near vision make the best candidates for any bifocal option, as compared to patients who are just recently becoming aware of their reduced near vision. There are also physical attributes that are very important to identify for those patients being screened for a translating design. The most important feature involves the lower lid and its relationship to the lower limbus. The lower lid must be firm enough to support a lens during translation and should meet the lower limbus or ride slightly above it. Patients who are currently wearing GP or PMMA lenses usually adapt very well to bifocal contact lenses. Current PMMA lenses wearers should be refitted to single vision GP lenses before being refit into bifocal design, in order to allow their eyes to equilibrate to the new lens material. While some patients are ideal candidates for the MetroSeg bifocal lens design, there are others who pose more of a challenge. Every option for the presbyope in both spectacles and contact lenses involves some sort of comprised vision. Patients who do not need vision correction for the distance are accustomed to excellent distance vision, and they have the most difficult time adapting to this compromise and may not be as successful with this lens option. While there are exceptions to every rule, these patients should be told very candidly about the realistic expectations for vision. For patients who have tried GP bifocals in the past and have failed with them, extra care should be taken to ascertain the reason for their failure, to make certain the same pattern is not followed. The desire that's prompting the patient to try GP bifocals again should also be gauged to make sure they have the motivation to succeed. Patients with a lower lid configuration that's significantly below or above the lower limbus are not usually successful with this bifocal design, because the lower lid is needed in the translation of the lens. Refitting them into another translating design will not improve their fitting success. Also, patients who require near vision and an upward gaze are not good candidates for this type of bifocal design. Patients whose physical and visual attributes make them a more challenging patient for the translating MetroSeg design may do much better with a simultaneous design, such as Metro's progressive lens. As with all bifocal lenses, an adaptation period is expected with the MetroSeg Crescent Bifocal. The patient will need to adapt to the physical sensation as well as the unique delivery provided by bifocal contact lenses. Make sure to have candid conversation with the patient at the initial fitting. This conversation should include an honest appraisal of the patient's expected vision, the time anticipated before adaptation is completed, and the realistic outcomes of wearing bifocal contact lenses. Adaptation is a process and is normal. Changes made to the lenses too early in the adaptation process could lead to greater problems, since changes are made based on misleading information. The MetroSeg bifocal lens can easily be fit without the use of a diagnostic lens set. Simply follow the nomograms provided or call the consultants at Metro Optics, and an initial lens can be designed for the patient. For new patients, utilize single-vision diagnostic lenses to determine the best lens-to-cornea relationship if a MetroSeg bifocal set is not available. With current GP patients, you can utilize their current lens parameters if they result in an alignment fit. Highly myopic patients who have high-riding single-vision lenses may need a steeper base curve in their MetroSeg lenses to avoid upper lid attachment. For most patients, an on-K fit or flatter is recommended in order to allow the lens to translate or alternate between the near and distant segment most effectively. High-minus patients whose lens powers are about -3 diopters may require a base curve that's a half diopter steeper than listed if excessive movement occurs. The initial diameter is based on the base curve of the lens. Flatter corneas will generally require larger diameters, while steeper corneas will generally require smaller diameters. This is an initial diameter recommendation only. A wide range of diameters are available for the customization of the lenses for the patient. Truncation is generally not needed for this lens design, and it's recommended that the lens is initially designed without truncation, even if the patient is currently wearing a truncated lens. However, if lens translation is not achieved because of loose lower lids, truncation may be necessary. In these cases, a minimum truncation of 0.3 mm is recommended. Determining the distance and near power of the MetroSeg bifocal lens is done in the same manner as the spherical GP lens. This could be done utilizing an over-refraction, or calculating empirically with Ks and Rx and base curve choice using rules of steeper add minus and flatter add plus. When determining the near power, the full amount of the add power found in the spectacle Rx can be incorporated into the bifocal lens. However, if the patient requires improved intermediate vision, a lesser add may be used. The most important factor in determining the placement of the seg height is the configuration of the lower lid in relationship to the lower limbus. The ideal lower lid configuration is when the lower lid positions at or near the lower limbus. If upon straight-ahead gaze, the lower edge of the limbus is tangent to the top of the lower lid, as it's shown here, order the segment 0.9 mm below geometric center for minus lenses and 0.6 mm below geometric center for plus lenses. Typically, the minus lenses will ride slightly higher on the cornea than plus lenses, so they'll need to have their segment slightly lower than plus lenses. If the lower lid is above the lower limbus, as we see in this graphic, position the segment 1.1 mm below geometric center for minus lenses and 0.8 mm below geometric center for plus lenses. For patients whose lower lids are significantly above the lower edge of their limbus, consider a simultaneous bifocal lens, such as the MetroProgressive aspheric multifocal. For patients whose lower lids are well below the lower edge of their limbus, they won't be able to accomplish adequate translation of the lens without assistance from the lower lid, and near vision will not be achieved. For these patients, a simultaneous bifocal lens option, such as a MetroProgressive aspheric multifocal, may work best. When evaluating the height of the segment, use an indirect light, such as a handheld pen light or the low beam on the slit lamp. This will keep the pupil to a size that more closely matches the pupil size under normal room illumination. Under normal room illumination, the top of the segment should be between the lower edge of the pupil and approximately 0.4 millimeter below the lower pupil margin. By following the guidelines prepared by Metro Optics, proper placement of the seg should be achieved. However, if the segment needs to be adjusted either higher or lower, the new position can be ordered either in respect to the geometric center or the bottom of the lens by simply calling in the information into Metro Optics. The amount of prism incorporated into the lens is determined by the amount of distance power found in the lens. Unless there is a need to customize the amount of prism, Metro Optics will utilize a standard prism as outlined in the table. One of the advantages to fitting the MetroSeg Crescent Bifocal is the uniquely shaped near portion. This large crescent-shaped segment allows the lens to rotate up to 30 degrees without interfering with distance or near vision. This enables the fitter to concentrate on other aspects of the lens fit without worrying about this previously frustrating aspect of lens design. If the lens fit is either too loose or too steep, the lens may rotate excessively or lock out of position. Once the lens-to-cornea relationship has been optimized, if the segment still rotates out of position, the lens can be made with base-in or base-out prism, or an adjustment to edge thickness may be necessary. For further adjustment, call our expert fitting consultants for a recommendation. Success with the MetroSeg bifocal lens can be evaluated by virtue of the patient's objective responses to comfort and vision, as well as the objective signs viewed with the slit lamp. Fluorescein evaluation of the lens-to-cornea relationship is best done with the blue cobalt filter and a yellow rattan filter. The fluorescein pattern should show a green band at the lens edge and a relatively even distribution of green over the remaining area. There should not be any noticeable areas of excessive pooling or bearing. The lens must have good movement propping quickly into place after the blink. The lens should rest approximately 1 millimeter below the center of the cornea, with the upper edge of the near segment slightly below the lower edge of the pupil. We'll look now at some problems that may occur with the lens fit and how to solve them. There is an adaptation with the MetroSeg Crescent Bifocal, as there is with all new lenses. Therefore, adjustments to the lenses within the first few weeks should be avoided until the patient has fully adapted to the lenses. The most common initial patient complaint is that the near segment interferes with the distance vision, even if the segment is in the proper position. The segment line should be at or below the pupil margin after the lens settles. The patient may see slight inferior blur when the segment is in position, but this is normal and should not interfere with the patient's distance vision. If a lens segment is too high, reduce the lens diameter by 0.3 millimeter. This can also be corrected by ordering a new lens with the segment 0.2 millimeter lower. If the lens segment is too low, the patient will complain about poor near vision. In this instance, this can be corrected by ordering a lens that is 0.3 millimeter larger overall. This can also be corrected by ordering a new lens with the segment 0.2 millimeter higher. If the lens is slipping under the loose lower lid, the lens can be truncated by 0.3 millimeter to increase the lid-to-lens interaction. If the lens has excessive movement, the patient may notice fluctuating vision at both near and far distances. If the lens has too much rotation and locks out of place, the patient may notice consistently poor vision at both near and far. To reduce lens movement, increase the lens diameter by 0.3 millimeter or order the lens a half diopter steeper. If the lens locks out of position, reduce the lens diameter by 0.3 millimeter. If that doesn't result in a better segment position, reposition the prism in the direction of the rotation. The wide range of parameters available for the MetroSeg allows the contact lens professional to custom fit any presbyopic patient. Anterior and posterior toric curves are also available for the moderate to high astigmat. Any parameters that go beyond the range here can be made available to the contact lens professional. We can make the MetroSeg in any major brand lens material. Selection of specific material is based on individual patient need and/or doctor preference. Simply call one of the consultants at Metro Optics to discuss the need for special design. The MetroSeg Crescent Bifocal is a great option for your presbyopic patients who need both crisp distance and crisp near vision. Its fitting nomogram is easy to follow and requires no diagnostic lenses. Metro Optics also has consultants standing by to help you empirically fit your next presbyopic patient. Just call 1-800-223-1858 and we'll get you started on the road to success.